the facility.
And I understand that the health systems, the hospitals that we just mentioned, that there are level 3 trauma centers. Specifically, what does that mean, Elaine or Dr. McGreevy, either one?
Yeah, so the state has set out 4 different levels of trauma acuity that you could designate your hospital to fall into. And a level 1 being the highest acuity, of which we have 3 in the state.
Technically 4, with the Mayo Clinic as well as the fourth
good
one.
point, yes. So I should say 3 within the metro area, and the Mayo Clinic is one as well. And then so they would have in-house coverage for most any conceivable scenario for traumatic events, out to a level 4, which does not have in-house coverage for a number of things that may or may not present. So level 3 falls in that middle ground. Basically, it requires that you have general surgeons who are all trained to deal with or have the training for various traumas to be on staff and available within a short period of time, as well as all the other ancillary services to go along with that.
What would be some of those traumas that they would treat at the level 3 trauma centers?
Well, any number of sports type injuries, maybe a skiing accident. In the winter, of course, here we see a lot of falls on the ice, which can be, bring about all varieties of injuries. Up to car accidents, which we see on some of the more minor levels. I would say that major car accidents, such as the ones that we've witnessed in the press here recently, unfortunately, those would be, we would, after those people or those people in those type of accidents would get steered towards a level 1 trauma center.
So the state has been, basically the hospitals required by state law now to have trauma centers at some designation, whether it's level 1 or level 4 and 2 and 3 in between. So what does that mean? Why do we need this? Why do we have to have this statewide system?
Yeah, I think that the real benefits to the community and to the state are, number 1, to the community, that people know within the hospital in their area or any hospital there that they're dealing with what effort and resource they put into dealing with trauma. And so that they can gauge that, again, against the acuity of whatever the injury is. It's very helpful for our emergency medical response teams, that they know, oh, this is a hospital who has, it's a level 3 trauma center. They are set up to take care of this type of injury. It's the closest facility to where this accident happened. That's a good location to take this patient. Versus, this is a very high acuity injury. The potential for real life-threatening problems is on the forefront of this patient's care. We may want to take them to a hospital that is immediately set up to take care of that type of injury.
And it really will help save lives, Elaine.
It's helpful from the standpoint of all of the hospitals are getting that type of training and knowing how to stabilize patients quickly and determine what are the injuries. Is it something our facility can care for, or do we need to communicate to a higher level facility that may have some of those specialty services or those complex services that Dr. McGreevy mentioned that those major accidents might need to go to?
Because it's really important to get that care within a very, very short time of when a trauma happens.
Right.
I've heard of this golden hour.
Exactly. There's the golden hour rule where we talk about making the correct diagnosis and getting the appropriate initial resuscitation and care. If you're able to initiate that within that hour, your chance of a positive outcome is dramatically improved over if those type of injuries languish out longer than that. I think the other really exciting thing about trauma designation in and of itself is also what happens inside the walls of the hospital. We have all these great facilities, the great staff to take care of these things, but if you organize them and you think through some of these things before these injuries or these incidents occur, then when they hit the door, then you have a system in place and ready to go. people aren't thinking about who we should call next or how we should get this person in there. That's already set up, and then the physicians and the teams in radiology, in the lab, and the operating rooms and so forth are ready to, we've got a plan for this, we're going to take this patient and get them the appropriate care immediately. So that's what the designation system has helped within the walls of the Health East hospitals that we've been working with.
So as you were saying, it's not just having another name for the ER, there's all these other components in there. Elaine, maybe you can kind of